Head to toe assessment, final video, sports contact injury. All right, how are you doing today?
Good.
Good. All right. Before we get started, can I please have your name and date of birth, please?
John Smith, July 1st, 2003.
Okay, John Smith. Do you know where you are today?
Yes.
Tell me where.
My house.
Can you tell me the date?
I believe it is December 13th, 2020.
Okay, sounds good. So, John, what brings you in today?
I bruised my knee playing sports.
You playing sports?
Yes.
Now, how exactly did you get this injury? Was it
I tripped and fell.
tripped and fell?
Yeah.
Okay, so no contact with anyone, just with the ground.
Yeah.
Okay, sounds good. So what's gonna happen here today is I'm just gonna perform a full head to toe assessment. Okay, I'm just gonna be checking overall general area, and then for the knee pain, what can you tell me about the knee pain? Is it throbbing? Is it burning?
It just hurts when I touch it.
Hurts when you touch it?
Yeah.
How can you describe the pain? Just when pressure is applied, it hurts.
Yeah.
And which knee is it in?
My left.
Your left knee?
Yes.
Yep, sounds good. So overall, okay, I'm just gonna assess the basics and all that. Sound good to you?
Yes.
All right. Are you allergic to anything overall?
Shellfish.
Shellfish?
Yeah.
Okay. Have you been taking any over-the-counter medications to kind of help with the pain for your knee?
No.
No?
Yeah.
Have you been at all icing it?
Only after it got bruised.
Only after?
Mm-hmm.
Okay.
But not since then.
I mean, how would you rate the pain overall?
7.
7?
Yeah. 7 being
Okay, fair enough. No, you don't feel concussed at all?
No.
You didn't hit your head coming down with the
No.
injury? All right, just making sure. Okay, John. So I'm going to do overall head to toe assessment. I'm just going to be checking every single area, making sure you're okay, and then we'll get to your knee. Sounds good?
Yes.
All right. And what sport do you play?
Volleyball.
Volleyball. Hit the ground hard, I'm assuming.
Mm-hmm.
Okay, that's fine. Okay. Then can I just see your face real quick? You know about the mole right here on your upper lip? Just making sure. All right. Just gonna take a look at your eyes, okay? Right. Look down. Up. Sorry about that. All right. Let me take a look inside your ear. Just real fast. This side. Okay, I'm gonna perform a whisper test. So cover your ear right here, and then I'm gonna whisper next to it. I'm gonna whisper a number. Just tell me what you can hear, okay?
99.
Okay. Sounds good. All right, let me see your nose real fast. Okay, symmetric. Okay. Let me see this. Write down for me. All right, I'm just gonna test the range of motion of your neck. So can you go like this, like that? All right. Straighten out your head. Push. Now push towards me. Okay. Do it again. That sounds good. There you go. Okay. And then now I'm gonna test your shoulders. So overall, can you do that? All right, sounds good. Now, can you try and do this, please? Your fingers should be touching. Are they touching? No. All right. Let me just see the back. Okay, that's fine. Now do it opposite this way now. Okay, that's fine. So if you don't mind, if you can take off your shirt for me, I'll just be listening to your lung sounds. Sounds good? Do you have any respiratory problems, such as like asthma, anything like that?
No.
Okay. Breathe in. Breathe in. Breathe in. Breathe in. All right. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. And last time, please. Your breath sounds are normal. There's nothing out of the ordinary. Usually, I've listened to anything wheezing, any crackling. Clearly, you don't have that. And I'm assuming you don't smoke. Okay. You don't have a problem with any. You don't have any throat problems, anything like that.
No.
Any kind of scoliosis or whatsoever.
No.
No, pretty straight. Okay, sounds good. And I'm just gonna listen for heart sounds. Sounds good.
Yes, sir.
All right. No breathing. I just simply listen. Okay.
Okay.
Patients S1 and S2 are audible. S3 and 4 are not. So that is normal. Okay. All right. So I'm just gonna inspect your abdomen. So if you could. Okay. No visual abnormalities on the abdomen in both quadrants. Now, before I start, do you have any like bladder problems? Do you have a problem getting to the bathroom at all? Any trouble peeing, pooping?
No.
Okay. No trouble pooping?
No.
Okay. Sounds good. I'm just listen to your bowel. I'm gonna listen to your abdomen for any abnormal bowel sounds. All right. Bowel sounds in the 4 quadrants are there. Nothing abnormal. Let's see here. Okay. I'm just gonna palpate your abdomen area, and then if you feel any pain, just let me know. Okay. Okay. Other than that, your abdomen is okay. So basically, your stomach is all good. All right. So you can put your shirt back on. That's fine now. And then just roll the sleeves. Okay. So I'm gonna be testing your hands, basically, strength, range of motion. So, just move your hands around for me like that, like this, that. Now I'm gonna test hand strength. Okay. So push and resistance, push back on me. All right. And then, okay. All right. Sounds good. Let me see. Let's see your fingernails real fast. All right, capillary refill in the patient's fingernails is less than 2 seconds, so it's normal. Okay. I'm gonna test for skin tartar. Basically, it kind of just tests for hydration in the skin and tenting. All right, so straighten your arm out. Patient's skin popped back into place right away after pushing. All right, can you close your eyes for me, John? All right, so basically, I'm gonna be testing sensation on your skin, on your arms, and I just want you to tell me if it's sharp or if it's dull.
Sharp. Dull. Sharp.
Now, it's an important part. Your legs and feet, if you don't mind, just rolling that up for me. And you did say it was your left knee, correct?
Yes.
Okay. You don't feel any heat towards the area. It doesn't feel warm at all whenever you touch it.
No.
You said it was just bruised, but it hurts to walk on it sometimes.
It hurts to touch it.
Hurts to touch it. Okay. Usually with the bruised knee, obviously just spend some time off it. Try not to move around so much. Limit your range of motions, or limit activity on the knee to avoid stressing it out even more. Because if it is just bruised, then it will heal naturally on its own. But it could be worse. Sometimes a lot of people's pain tolerance is a little different, and it could be a lot worse. You could possibly have like a torn muscle in your knee somewhere. I mean, you don't want that. You just want to make sure that it's bruised. All right, push down, up, push down, up. Okay, good. Can you lay back down?
Which way?
Just lay down straight. And then I'm going to be testing the range of motion on your knee. So like this. So basically tell me when it starts to hurt. We'll do it again on the right leg. All right, and can you you can sit up now, actually. And can you curl your toes up? Now down. Okay. Good. And then one more thing. I'm just going to do the same thing with your toenails. So can you take off those socks? Can you put your socks back on, John? All right, capillary refill in the patient's toenails are less than 2 seconds. Patient's range of motion and strength in the legs and ankles are normal. No type of weakness settled. Now I'm going to do the same thing again that I did with your arms. So close your eyes. Once again, tell me sharp or dull. Pull. Sharp. Dull. Sharp. Patient sensations are there. No diminished sensation whatsoever. All right, one last thing. We're gonna perform a gait test to make sure your knee is simply just bruised. It can kind of determine if at all that's the case. Because usually with a sports injury, especially in the knee, you will show some major walking problems. So essentially, you're gonna struggle a little bit in path and deviance, and path, the strides you're taking, and simply just the way you carry yourself. Sounds good. So if you can start from that rocking chair, okay, and then back to the wall right here, and then back again, okay. Hold on, sorry, I should have told you when to go. Start. Okay. You can go ahead and take a seat again. Patient performed gait test. No visual limping. Patient had a set path. No abnormal changes in stride. Nor did he struggle walking back and forth across the room. And patient finished gait test in less than 9 seconds. Do you have any problems like getting up from the bed overall?
No.
Because of your knee? Okay. Just making sure. Other than that, with that being said, you're pretty much good to go. I don't see any overall problems with your knee. Okay, like you said, it's just bruised. And looking at it even more, I didn't see any kinds of swelling whatsoever in the knee. And looking at both knees, when we looked at your legs, I didn't see any abnormal differences. So no changes in size. It looked pretty much the same. Other than that, I can conclude that it is a bruised knee. But if at all anything changes, such as more pain, it suddenly becomes difficult to walk, your knee starts getting swollen, it feels warm to the touch, give us a call. We'll be happy to look at it again. Other than that, your knee, let it heal naturally. If you feel any worse pain, you can take any over-the-counter medications. I would suggest Tylenol or Aleve. Do you have any questions for me?
No.
All right, and that settles it, John.